Hi everybody and welcome to another episode with the Anxious Resistance. Today I'm going to be talking about nitrous oxide and how it is a potential treatment for depression. Nitrous oxide is known commonly as laughing gas. It is often used in dental offices and even before surgical procedures. You might be wondering what an article about nitrous oxide is doing on a mental health page. Recently, due to the gaining popularity of ketamine therapy, there's increasing interest in nitrous oxide as a treatment for depression, and it is not without good reason either. So, how does nitrous oxide work and how could it possibly treat depression? Nitrous oxide is a moderate blocker of the NMDA receptor. This is the same receptor that ketamine also blocks. So nitrous oxide has several other actions, such as moderately blocking some nicotinic acetylcholine receptors. It also weakly inhibits AMPA, kainite, GABA-C, and 5-HT3 receptors. But that's not really what we're focusing on here. What we want to focus on is its blocking of the NMDA receptor. So what kind of advantages does this have versus other antidepressants? The biggest advantage of nitrous oxide is that it uses that NMDA blocking action to treat depression. This mechanism is only taken advantage of by one indicated antidepressant and ketamine, which is used off-label. That means that if you have failed traditional antidepressant medications like SSRIs, which are selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors, this is a potential option for you. It is easier to administer than ketamine. Ketamine needs an IV infusion, whereas nitrous oxide is an inhaled gas. The antidepressant effects of nitrous oxide last for a week or longer. Nitrous oxide is also better tolerated than ketamine and does not have psychomimetic side effects. Psychomimetic side effects are like psychosis and can produce hallucinations, acute confusion, and even memory loss. This is one of the biggest drawbacks to ketamine therapy, and why you have to be monitored after having your ketamine therapy for up to several hours afterward. So what are some disadvantages of nitrous oxide versus some other antidepressants? Nitrous oxide must be administered in a controlled environment, like at a doctor's office or clinic. That makes it hard to access. The other problem is that the administration would need to happen regularly. It can still have some serious side effects like delirium. Nitrous oxide also depletes vitamin B12. If you repeatedly use nitrous oxide, you will likely need to supplement with B12. So what is the evidence for the use of nitrous oxide in this way? I'm going to quote some articles here that are studies about using nitrous oxide for depression and other mental health conditions, and you can find them in the full article, which we will link in the description. So here's the first article. Study authors stated that nitrous oxide appears to have rapid antidepressant effects similar to ketamine, but without such ketamine side effects as delusions and hallucinations. And then the second article here concludes, preliminary studies support the feasibility of administering nitrous oxide for depression. However, appropriate blinding is a critical challenge, so that means the quality of the study needs to be improved. It stated that they want to scale random controlled trials with repeated doses of nitrous oxide and follow-up times beyond 1 month are needed to confirm the feasibility, therapeutic efficacy, and sustainability of response for nitrous oxide. This study is kind of saying some more long-term, more quality studies need to be done to fully establish this as a viable treatment. And article number 3 here concludes that nitrous oxide treatment led to a statistically significant reduction in HAM-D17 scores compared to placebo. HAM-D17 scores are used to measure major depressive disorder symptoms, showing that there was an improvement versus the placebo means that there was some effect here from the nitrous oxide treatment. And article number 4 concludes, this proof of concept trial demonstrates that nitrous oxide has rapid and marked antidepressant effects in patients with treatment-resistant depression. And another article here states that the recent pilot findings with nitrous oxide for treatment-resistant major depression are intriguing and indicate that mechanisms other than channel block for inhibiting NMDA receptor function may be effective for treating patients with severe and refractory mood disorders. Like ketamine, nitrous oxide appears to have rapid, beneficial effects on suicidal ideation. Importantly, while nitrous oxide, like ketamine, has abuse potential, it does not appear to share ketamine's psychomimetic or cognitive side effects, making it an attractive alternative for therapeutic development. And again, another article here concludes, there appears to be encouraging results when treating patients with treatment-resistant major depression with nitrous oxide in a 25% concentration. Nonetheless, there needs to be further investigation, namely through studies that compare nitrous oxide with other valid treatment-resistant major depression treatments and not only versus placebo. So they want to establish if nitrous oxide can be more effective than current antidepressants. So they're saying it's already better than placebo, so it's a viable treatment, but is it better than what we already have? Okay, so now for the anxious resistance take on nitrous oxide. Nitrous oxide shows some promise, but it has some major drawbacks. If you're looking for a medication that works on NMDA receptors, this should not be your first choice. Other medications and supplements like magnesium, riluzole, and memantine are much better choices. They can be taken at home. Nitrous oxide is an interesting concept, but difficult to implement. There are better options to try before you get to this point. Thank you so much for watching this video. If you enjoyed the content, like the video, subscribe to our channel if you want more, and thanks so much for watching.